Hello everyone, it's Dr. Gupta at the Dermatology Laser and Vein Center, and here we are with a lovely patient today who is suffering from hyperhidrosis, which means excessive sweating, and it can actually occur in any part of the body. The most common areas we treat are the underarms, followed by the scalp, along the hairline. It can also present in the groin, in the hands especially, or the soles of the feet even. And in this case, our patient is having sweating across the lower back area, which just runs down her bottom. So we are going to try to address that for her. And it can be really life-changing. It's the only procedure, in my opinion, that works so effectively, so quickly, and gives a nice, long-lasting result. For some other areas, for example, the underarms, we now have more permanent solutions such as ThermiDry, or now we're using our Morpheus Prime technology to permanently destroy those sweat glands, but it's not yet an approved treatment for other parts of the body. But we're hoping at some point it would be lovely to have a treatment for the palms especially, or even other parts of the body. But right now, that's the only place where we could potentially get a permanent improvement. Actually, interestingly, the sculpture procedure has also been shown to improve sweating, especially when applied to the underarms. We haven't tried it on other parts of the body, but you'll have to tell us how your abdomen does in case you have sweating from there, because the patient did actually also get sculpture in that area. So that's just an aside. Other treatments we can do are liposuction. Liposuction will also help to destroy the sweat glands under the skin, especially when we use the Vaser technology. So that can also be done in the underarms and potentially other parts of the body. So those are the possible treatments. Today we're going to do Botox. We already injected some Botox along her hairline because she notices sweating coming down her forehead, and now we're going to inject the lower back. We did a starch iodine test first where we applied basically iodine to the skin, and it is just like a yellowish color, and then when we apply the cornstarch, it actually, wherever she's sweating, turns kind of black, and so you can see where her sweat glands are more prominent, and that allows us to give a more directed treatment for her, so we don't waste a lot of Botox in areas where she may not be sweating from. Okay, so we'll get started, and it's just tiny little needle injections. It shouldn't be too painful. Just are going to follow sort of a grid-like pattern. Make little blebs under the skin. How are you doing?
Fine.
Good. And in this case, we're using about 140 units today, so about 70 units in each side. We can customize that to a patient's budget. My recommendation would have been for probably more like 200 units total, but this should be a good improvement for her. Just little blebs. It's a very small, fine needle, so not too painful. Usually starts working just within 2 or 3 days. Okay. All right. So that's it. That is the procedure. And like I said, it will start working now within just a couple of days. You should see some reduction. Okay.